Hi, my name is Casto, and I'm glad you've joined me today for my presentation on medical coding's connection to risk adjustment. In the risk adjustment basics video, we learned about risk adjustment and how this process is used by healthcare facilities and payers. In this presentation, I'm going to discuss how medical coding is used in risk adjustment models. And risk adjustment is a hot topic in the reimbursement world. Medicare Advantage organizations, also known as MAOs, use the risk adjustment for their contract bidding process. CMS uses risk adjustment to determine payment levels for MAOs based on beneficiary demographics and health status. CMS determines incentive payments using a risk adjustment model. And CMS also establishes premiums for the individual and small market employers by using risk adjustment. The model I'm going to use to illustrate the connection between medical coding and risk adjustment is the Centers for Medicare and Medicaid Hierarchical Condition Category model. That's a mouthful. So we often just refer to this model as HCCs. This risk adjustment model is used by Medicare to customize Medicare Advantage payments so that the monthly payment for each beneficiary reflects the medical and demographic profile of each payment. This model examines the demographics of the beneficiary, such as age, sex, and Medicaid status, and the health conditions for each patient, such as diabetes or neoplasms. The past year is referred to the base year in this model. So using the base year data, CMS can predict the costliness of care for each beneficiary for the next year. The predicted costliness determines the payments that CMS will provide to the Medicare Advantage organization to care for the beneficiary. So what role does medical coding play? Each time a beneficiary visits a healthcare provider, the visit, encounter, or admission is coded using ICD-10-CM diagnosis codes. The diagnosis codes are alphanumeric codes that are used to categorize diagnoses, medical conditions, and health statuses. By collecting a beneficiary's ICD-10-CM codes for an entire year, Medicare can establish the health status for each Medicare beneficiary. Let's look at some medical conditions and their associated ICD-10-CM diagnosis codes. Each of these medical conditions has an associated diagnosis code and is used in the HCC model to predict costliness of beneficiary care. So you can see here in this graphic, for example, C25.0 is the ICD-10-CM diagnosis code for malignant neoplasm of head of pancreas. As you can imagine, because ICD-10-CM codes are used to establish payments to the Medicare Advantage organization, it is crucial that diagnosis codes are accurate. And medical coding can be a challenging field. There are numerous coding rules and guidelines that you have to follow in order to accurately code a healthcare admission. MAOs are using medical codes reported on claims by various healthcare facilities. Therefore, coding accuracy could vary by facility. And the Medicare Advantage organization may need to validate the codes by reviewing the medical record documentation for each healthcare encounter. So how do these ICD-10-CM diagnosis codes impact the beneficiary's health risk score? Let's take the 5 diagnoses from before. In this table, you can see how each diagnosis code is part of an HCC category. So for example, the C25.0 diagnosis score for malignant neoplasm of the pancreas is in HCC 9, lung, brain, and other severe cancers, including pediatric acute lymphoid. Now, each of these HCCs has a risk score. When CMS adds up the risk scores for a beneficiary, they have the health risk score. Let's look at an example beneficiary. Here we have beneficiary A. The MAO collects beneficiaries' diagnosis codes over the past year. With these diagnosis codes, they establish HCC groups for their beneficiary to create their health profile. This beneficiary has 3 HCC categories that have been established: HCC 18, HCC 43, and HCC 111. As you can see, not all diagnosis codes are included in the HCC model. For example, claustrophobia does not have a major impact on future healthcare expenses. Therefore, it's not included in the HCC model. Likewise, urinary tract infection is not included because it's an acute condition, not a chronic condition. Now let's move on to see how these HCCs are used to develop beneficiary A's health risk score. When we add the health risk score to each HCC, we can see the condition's impact on future healthcare expenses. So you can see here HCC 18 for diabetic retinopathy has a health risk score of 0.318. In our example, COPD has the highest impact on beneficiary A's health risk score because it has the highest score in this example at 0.328. All the scores are added together for a final health risk score of 0.919. So let's take a look at 3 different beneficiaries that would be included in this Medicare Advantage organization. It's important to start with the information that the average risk score for a Medicare beneficiary is 1.0. And in this example, we have the monthly payment to the Medicare Advantage organization for an average Medicare beneficiary with a health risk score of 1 is $1,000. Using the total health risk score for beneficiary A, we can see that the monthly payment would be reduced to $919 because beneficiary A has a health risk score or health risk adjustment factor less than 1. A beneficiary B has a health risk score of 1.247. So therefore, the monthly payment for this beneficiary would be $1,247. And beneficiary C has a health risk score of 1.057. So their adjusted payment is $1,057. For the upcoming year, beneficiary B is expected to be more costly than beneficiaries A and C. Therefore, the per member per month payment to the Medicare Advantage organization is higher. This illustration really shows how important accurate coding is within the HCC model. And anytime medical coding impacts payments, there is an auditing program. CMS uses the Risk Adjustment Data Validation Program, which we refer to as RADV. RADV is used to ensure that all diagnosis codes submitted for each beneficiary are accurate and supported by the medical record documentation. So we refer to RADV as an improper payment review audit for Medicare Part C. And RADV audits do identify an accurate code submission, as you can see in the graphic on this slide. This is the most recent payment integrity scorecard, and as you can see, fiscal year 2021 overpayments are significantly higher than previous years. In fact, $6.7 million higher than fiscal year 20. The primary causes of improper payments under the HCC model are medical record discrepancies, so discrepancies between admissions, documenting the diagnosis, and insufficient documentation to support diagnoses submitted for HCCs. There are several conditions at high risk for incorrect reporting, as shown on this slide. Examples are chronic kidney disease, stage 5, or atherosclerosis of the extremities with ulceration and gangrene. And Medicare Advantage organizations often hire risk adjustment coding professionals or risk adjustment consulting firms to assist them with improving coding accuracy at their MAO. There are many potential careers for HIM professionals in risk adjustment. This graphic shows 3 different career pathways. And the first is coding, second coding analysis, and third is careers specific to risk adjustment. Careers in coding or coding analytics all involve risk adjustment or touch risk adjustment in some way. These careers may be listed under a variety of job titles, and I've listed some examples here. But generally, any medical, dental, vision, coding, or billing position title, or any coding or billing analyst, auditor, or quality assurance title fits into the first 2 career categories. There are also careers specific to risk adjustment for HIM professionals, and some examples are listed in the 3rd column all the way to the right. Some will have risk adjustment in the title, such as risk adjustment coder or risk adjustment coding auditor. However, some titles may be specific to a risk adjustment model, such as HCC coding specialist or HCC risk validation auditor. Also, the specialization increases as you move horizontally from left to right in this graphic. So experience as a coder is generally a prerequisite for coding analytics, and experience in coding and/or coding analysis is often preferred for positions specific to risk adjustment. Do you want to learn more about these careers? OHIMA has developed a revenue cycle hub for you to easily access informational videos, including today's video, as well as articles, careers, certifications, and education related to the revenue cycle. If you are interested in exploring a career in the revenue cycle or simply would like to learn more, please scan the QR code on the screen or visit ohima.org/revenue-cycle. All of OHIMA's information videos are available under the Resources tab. Thank you for joining me today, and I hope you found this presentation helpful. I've included my email if you have further questions or comments. Thank you.